Triple-negative breast cancer is an aggressive subtype of breast cancer, more aggressive than some of the other subtypes, and often affects young women, often affects women from ethnic minorities from a Western point of view. And the standard treatment at this point in time is chemotherapy. Targeted therapies were limited, but fortunately we are just introducing increasingly targeted therapies into the treatment of triple-negative breast cancer. If you look at early triple-negative breast cancer, most patients would receive neoadjuvant, which means preoperative chemotherapy, and then have surgery. Now, if patients receive neoadjuvant chemotherapy, there are two things we can learn. Those patients who have a fantastic response, and a fantastic response means what we call a pathological complete response, or PathCR, and that means that the cancer is completely gone. We don't find any trace of cancer when we do the surgery. Those patients have a fantastic outlook. 90%, 95% of these patients won't have disease recurrence over the next 5 years, which is essentially a very high chance of being cured from this cancer. On the other hand, patients who do not achieve a PathCR, those patients unfortunately have a slightly higher risk of disease recurrence, and that can be around 40% over the next 3 to 5 years. So we're trying to achieve in triple-negative breast cancer is find neoadjuvant therapies that can increase the PathCR rates, because we have demonstrated there's a strong association between PathCR and recurrence, reducing the risk of recurrence, but also overall survival. If you look at conventional chemotherapy, if you look at anthracycline taxane combinations, the PathCR rates are around 40%. If we add in platinum, which is what we did in our trial, the PathCR rates go up to about 50-52%. So that's the benchmark we'll be starting from, and that's what we try to improve by adding immune therapy to preoperative chemotherapy.